universities and colleges across the country are working together to stop COVID-19 and help those who have contracted the virus. Schools such as Stanford University or University of Chicago are working with the recently FDA-approved remdesivir, which attacks the virus and stops it from spreading within the human lungs. However, at the University of Idaho, they are taking a different approach, one that could save us from future viruses. Jagdish Patel, research assistant professor in the Department of Biological Sciences, understands that the COVID-19 strain is a ball with spikes. These spikes attach to the receptors of the human cell and then multiply. Dr. Patel wants to make a drug or shield that protects those receptors.
You can imagine that this shield as a key and the human cell as a lock. Uh, there are millions of possibilities out there for a particular key, and to find the right key, you would have to probably try each key one by one in the lab.
Once the preliminary tests have reduced the amount of keys to a few, Paul Rowley, an assistant professor in the Department of Biological Sciences, can test the said keys or compounds.
We grow essentially human cells in dishes, and we essentially use those cultured human cells. And a lot of them are susceptible to attack by coronavirus.
Once they find a compound that works on these grown cells, then drug development and human trials can begin. After testing, the team would need approval from the FDA.
That shield, in theory, should protect against all coronaviruses that bind that receptor.
Dr. Rowley hopes that the compound they are looking for can be used in the future, universally against several forms of the coronavirus.
It's likely we could have another outbreak in the future. So at this point, if a new virus also used this same receptor, we would have a therapeutic ready to go to combat any future outbreak.
As for remdesivir, since it only attacks the virus, it has its own problems.
We find often that the viruses will evolve to escape these kinds of treatments.
Though that hasn't happened as of yet, U of I still has obstacles to face, such as efficacy, stability, implementation, and location of their drug. Yet, that is far in the future. Mason Bartholomew, KLEW News.